One of the ways we want to look at meningiomas and the meningioma surgeries we do, we're looking at blood transfusions. How do we know which one of these patients are going to need transfusions when we do these surgeries? And so one of my fellows, Dr. Logman, who's now a neurosurgery resident, did a retrospective study looking at the meningiomas that we did surgery on. And what they found here was that when meningiomas were 5 centimeters or longer, bigger, or if the operative time took about 10 hours. Now, the first thing that you should take away if you've never been in the OR or you're not a neurosurgery resident or medical student in neurosurgery is, are you kidding me? 10 hours? And I'm saying yes. The average surgery is going to be 6 to 8 hours, depending on the size. But if you have a 5 centimeter tumor, your surgery is going to push 10 hours. And so if you don't love what we're doing, or you don't love surgery or neurosurgery, 10 hours, I mean, imagine trying to watch Netflix for 10 hours. That's hard. Even if you love the show. Now imagine trying to watch Netflix of a show you hate. That's really hard. Brain surgery, when we're in the flow and in the zone and you're enjoying what you do, those 10 hours pass like this. But when the surgery is approaching 10 hours or more and the tumor is 5 centimeters or bigger, your risk for transfusion starts going up and up. And so what we try to create is a 10-5 rule. If the surgery is approaching 10 hours or it's 5 centimeter or bigger meningioma, everyone in that OR, including anesthesia, the medical students, the residents, and the attending, should be concerned that this patient may need a blood transfusion because this is that cohort of patients. And if you want the specifics, Dr. Al-Khalid, Dr. Logman, Dr. Shepard, these are the doctors who did the study, and you can look that up in another paper. If you're going to look at tumors before surgery, one of the things we can do before we operate and cut the tumor out is we can do an embolization. We can stop the blood flow that goes to the tumor and go in and cut the tumor out. And so this is called embolization. And what we are trying to find is which tumors do we embolize and which tumors do we not embolize. And we use a semi-automated process, computer, to help us with that. Remember that meningioma we saw in 3 dimensions? This is that tumor. And if you could see that tumor, and if the computer can segment what is the tumor automatically based on the contrast enhancement, I'm waving my hand as if you could see me pointing to the screen, sorry. If you can see the tumor here, and see it now, the tumor is being segmented based on its contrast enhancement. You see, and now the computer recognizes what is tumor and what is not tumor, what is brain, what is mesoderm versus ectoderm. And if you're looking inside the tumor, what we can do next is we can then see what are the flow voids, how many blood vessels and how big are the blood vessels in this area. And if you add it all together, what is the volume of all those blood vessels? And we found that if the MVI, the Meningioma Vascularity Index, is less than 2.5 cc's, you probably don't need to embolize. Whereas here, this is a different meningioma, and the MVI is greater than 2.5 cc's. This is a tumor that is very helpful to embolize. It's going to make a difference in this patient's surgery. And this is a different tumor that's MVI is greater than 2.5 cc's. And so what we found was that controlling for tumor size, bigger tumor, small tumor, doesn't matter, that the risk of blood transfusion went up when the MVI was higher. But more importantly, we found out that those patients who got embolized, they lowered their risk for transfusion, and that the MVI predicted which patients needed embolization and which didn't. And it was based on the MVI. And this was published in the Journal of Neurosurgery. Again, Dr. Logman was our neurosurgery fellow, and Dr. Reza Jahan, he's a neurointerventionalist here at UCLA.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.